The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. Welcome to the next episode of TMD Demystified. I am Tony Urbanek. Today, we're going to be talking about how common TMD actually is in our environment. What is the prevalence for this problem? I have a lot to say about that and why. Obviously, it is prevalent to some degree, for sure. Everyone agrees on that. Every dentist has to deal with it one way or another. Most of them don't want anything to do with it. That's a fact. In fact, almost all of them don't want anything to do with it because they think it's a big black deep hole and it is just a problem for their practice, which is not true. I've discussed many times why that is not true, because the average dentist is taught that this is a complicated problem, which it is not. When you understand what the pathophysiology is, the real pathophysiology, not the made-up pathophysiology that is taught in dental schools and elsewhere. It's not a big complicated problem. You just have to understand a little bit of cell biology and a little bit of neuroanatomy and a little bit of gross anatomy. Anyway, the title of this episode is TMD is a much bigger problem than thought previously. TMD is a much bigger problem than thought previously. So let's start here. How big a problem is this generally considered? Well, if you read the studies, lots of them, there's lots of studies about TMD as it works out. The studies come from different countries, different populations, different times. They've gone on for at least 40 or 50 years studying the prevalence of TMD. The first scientific article about TMD was published by Dr. Robert Costin in 1934. He was an ENT surgeon. I mentioned his seminal article, which described some of the symptoms and brought it to the attention of the readers that the cause was lack of dental support. In other words, missing posterior teeth. That was his theory at that time, 1934. And that's where all this started. And that's why for 2 decades it was called Costin syndrome. Through the 30s and the 40s and into the 50s, it was better known as Costin syndrome. The prevalence became much more common because the symptoms became more recognized. It became into view of the professions, both medical and dental profession. Primarily the dental profession started taking a look at it. In any case, the prevalence, depending on what studies you read, fall between 15 and 30% of the population. It is well known, well accepted, and again, the studies vary between what percentage is prevalent in females versus males, but generally speaking, if you talk to the average doctor who tries intuitively to treat TMD, he will say it's roughly 90% females and 10% males. And that has been my experience, personal experience after treating TMD patients, both surgically for 36 years and non-surgically for 15 years, non-surgically exclusively for 15 years, which adds up to well over 10,000 people that I've done consultations with, well over 10,000 consultations, and probably more like 5 plus 2, 7,000 actually treated patients with this problem. 2,000 surgically and over 5,000 non-surgically in the past 14, 15 years. My experience is that it's 90% females, 10% males. Let me just drop the fact on you that's in the literature for 70 years, which explains why it's a female problem. No one reads the scientific literature, but it's in there clearly in many different types of articles addressing chronic inflammation. Chronic inflammation is exacerbated by estrogen. That is why TMD is primarily a female problem and fibromyalgia is a female problem. Because of this one fact, estrogen exacerbates inflammation. And all the symptoms are driven by chronic inflammation within the temporomandibular joint, so it stands to reason it would be expected to be a female problem if estrogen exacerbates inflammation. This is not rocket science, ladies and gentlemen. It's not rocket science. It's just a little bit of reading within the science that is already there, which is actually what I did. I read various articles about inflammation, chronic inflammation. I knew a lot about temporomandibular joint, treating it 36 years surgically, well over 2,000 surgical procedures, and then 14 years ago decided the surgical route is not the best, could not be the best route to treat this problem, because a third of the patients would be back within a year or two with the same symptoms, which led to my independent research, which I've talked about extensively, and findings. So back to the topic, what is the prevalence? What is the real prevalence of TMD? Well, we start out in the quote articles between 15 and 30%, depends on the country, depends on the culture, etc. But actually, it's much higher. I quote, and I'll tell you why I quote this. I'll explain it thoroughly. I quote that at least 45% of the female population in the United States of America have and exhibit and suffer from TMD symptoms. Let me run through it again, what the symptoms are. And there is no dispute. Of course, this is all a loaded question. TMD is probably, if not the highest, probably one of the most frequently argued topics within dentistry. And it shouldn't be, but it is, because most of the people who try to treat this treat it from the wrong point of view. They treat it from the point of view that this joint is different. My first discovery was this joint is no different than any other joint in the body. That is a fact. This joint operates like no other. It operates like any other joint in the body. It is not different, as which every dental school teaches, that this joint is different, unique, complicated, because it has a complicated name. Gangliomo-arthrodial joint. Oh my God, that's a complicated name. It must be a complicated joint. It's a joke. This is just simple science. So what are the symptoms of TMD? The symptoms of TMD, undisputed, are frequent and or recurring. And keep this in mind as we proceed as to why the prevalence is actually much higher. The actual symptoms are frequent and or recurring headache, earache, jaw pain, neck pain, tinnitus, ringing in the ears, subjective hearing loss, a feeling of fullness in the ears, dizziness/vertigo, upper back and shoulder pain and tightness, arm, hand, finger tingling and numbness, and various kinds of jaw locking. These are the undisputed symptoms of TMD. There are a few symptoms I will not mention right now that I have run into. I'm still working out the volume of patients with these symptoms, but I firmly believe that there's a few additional symptoms that are confused frequently with other medical diagnoses. The problem is all these disparate symptoms, and certainly no one argues that these symptoms are disparate, spread out and make no sense as a common cause. They're disparate symptoms, and that's what started the confusion. No one could figure out how you could get all of these disparate symptoms from one particular cause, which is at the point something to do with the TMJ, temporomandibular joint. Well, as it works out, the common denominator is chronic inflammation rather than symptoms being originated in the muscles. They don't originate in the muscles. They originate with chronic inflammation, and chronic inflammation originates within the joint because of three circumstances. I call them circumstances. Circumstances would be bruxism, too much clenching and grinding, acute trauma of various kinds, motor vehicle accidents, whiplash injuries, 4x4s off the back of a pickup truck, bar fights, athletic accidents. Here in Tennessee, a lot of horse accidents, and functional malocclusions of different varieties, functional malocclusions, where your teeth fit so poorly together, or your jaws fit so poorly together, not just teeth, the entire jaws don't match to the point that it overloads the joint, causes damage, creates chronic inflammation. All three of those circumstances do nothing more, nothing less than damage a joint, overload a joint, damage a joint. Just like you can damage a knee or a hip or an elbow because of too much use, too much force. That's where the damage comes from, ending up with chronic inflammation. Getting back to the prevalence. Well, here's the problem. Having those disparate symptoms that appear to be having nothing to do, originating from this little joint in front of the ear, the other professions think that it's something else. They frequently misdiagnose TMD. That's the issue. That is the issue. That is the issue of why the prevalence for TMD is actually much, much higher than the articles in the past journals for the past 40 or 50 years have been insufficient, because they have not included the myriad number of misdiagnoses by the other healing arts, especially the medical doctors. And because I am also a medical doctor and I have the union card to be a medical doctor, I can't be smoothed by the medical profession, because I've studied that, especially in detail, regarding these symptoms, especially these symptoms that are associated with TMD. What symptoms? Frequent or recurring headache, earache, neck pain, upper back and shoulder pain, tinnitus, subjective hearing loss, and vertigo. Those symptoms, if you have one or more of those symptoms and present within the general medical establishment, the last thing, if ever, that the medical doctor, nurse practitioner, physician's assistant will think of, chiropractor, will think of, is TMD. If you present with chronic headaches, bad headaches for sure. Patients complain bitterly of temporomandibular joint headaches, very bitterly. And temporomandibular joint headaches can be extremely, extremely painful and cyclical. They come and go. They are diagnosed by the medical profession as migraine headaches, or at best tension headaches. And the patient is delivered a series of drugs, which don't help chronic inflammation within the temporomandibular joint. They have the wrong diagnosis. That is huge. That one diagnosis, misdiagnosis alone in the United States is done to millions of primarily females, 10% males, 90% females. That misdiagnosis I have observed over thousands of times out of those 5,000 treated cases and over 7,000 or 8,000 consultations, seen it constantly. I mean, at least 50% of the patients that I see with TMD headaches, and I've explained exactly how chronic inflammation creates headaches and various facial pains consistently. But when they present to their physician, they're diagnosed with migraine headaches or tension headaches, given drugs, when actually all that you need to do is decrease the inflammation within the joint by resting the joint.